So today what we're doing is what people call floating or occlusal equilibration, which includes a thorough oral exam. But it's more about balancing out the teeth so that we balance out abnormalities of wear. So the goal with that is teeth in horses can wear very unevenly for a lot of different reasons, and if they're wearing unevenly, they can wear out prematurely, and that'll predispose them to things like periodontal disease, maybe certain fractures, teeth shifting. So what we're really trying to do is balance out that pressure and the wear that they undergo with mastication. And there's some people that think that this type of dentistry is too aggressive or bad. And they can be right, because if it's not done correctly, it's like anything, it can definitely be an issue. So I understand where that's coming from. But if somebody is really trained in what they're doing, and they understand the parameters that we're working with, it's actually counterintuitive. It's less aggressive than many other types of dentistry, because each time we work on the horse, we're actually doing less and less on the mouth. So this is a horse, this will be the third time we've done this horse, and we'll show you guys how there's actually not a lot to do to maintain the kind of steady state that we're in. But the first few times we did them, we had to do a lot of work. So we're actually doing, if we're doing dentistry right, we're actually doing less and less and less work as we work on the horse, instead of every year it being a repeat of the same amount. Because once the teeth are wearing uniformly, then we don't need to kind of keep grinding on things. All we're doing at that point is maintaining the status quo and taking sharp edges off. So let's see what that looks like. Okay, so if we look here, this horse is 8 years old and he has an amazing mouth. Everything is nice and balanced. All the teeth are at the same angle, same height, same amount of clinical crown. So as long as this is maintained, this horse is going to have an amazing dentition for a really long time, and we can minimize a lot of other problems that may come along. You can see on the other side it's very similar. So he's got, this is kind of the goal of what we're looking for. So I think that's something that's important to keep in mind, is that opinions in the world, which is fantastic, but a lot of people say how dentistry should be done, whether that's at a conference or online or in lectures. But what's really interesting is seeing the results and seeing what people are doing. And one of the things I wish people would do more is share their actual work, instead of just our words, because in the end, words are really cheap, and I can make myself look really good on paper or talking, but it's really, the proof is in the pudding. So I think the standard really for education should be for people that are educators to actually show their work. And so that's why what we're doing here is just showing you what these mouths can look like. And then we can have a debate whether we think that we can improve this, or if there's things that we're doing wrong or things that can be done differently. Now we can have a conversation with colleagues and peers, and you guys feel free to leave comments and suggestions or ideas based on that. But if we don't really know what somebody's doing, then it's hard to have a discussion to even know if we're on the same page, or what we might be agreeing and disagreeing with. So I think sharing is better.